I'm going to talk about dementia, its clinical features, clinical implications, and treatment options such as management issues for dementia. Specifically, I'm going to be discussing restorative and compensatory approaches, how both fit into intervention for a person with dementia, and the research that backs it up. The purpose of this presentation is to discuss dementia as a neurodegenerative disorder and its clinical features. When treating a person with dementia, there are two intervention approaches used by speech-language pathologists. The literature describes both compensatory strategies and restorative approaches. Research has found that a restorative approach is more beneficial to patients in the earlier stages of dementia, while compensatory strategies can be used in either early or later stages. Both approaches target memory deficits. Dementia is a neurodegenerative progressive disease. As we know, neurodegenerative is an umbrella term that encompasses medical conditions that primarily affect the neurons in the brain, and progressive is getting worse over time. It is the loss of cognitive functioning and behavioral abilities. Cognitive functioning includes tasks of thinking, remembering, reasoning, and decision making. Dementia is now named major neurocognitive disorder by the DSM-5, and there are four major types of dementia, including Alzheimer's disease, which we'll talk about a little bit more in the upcoming slides, Lewy body dementia, vascular dementia, and frontotemporal dementia, among many others. In order to be diagnosed with dementia, there must be memory deficits and interference with activities of daily living. Common clinical features that a person with dementia will display include deficits in memory, visuospatial, behavioral changes, and personality changes. The patient tends to ask the same questions and will have difficulty following directions and completing routine tasks. So the purpose of this presentation, as I said, is to discuss this dementia, but it'll also focus on memory, as memory is often the earliest and most impaired function. There are two intervention approaches to treating a person with dementia, and they are by ways of compensatory strategies or a restorative approach. So now we're going to look at some literature behind both. So when choosing a treatment approach, the professional, like most likely an SLP, wants to make sure it's evidence-based. So we're going to take a look at two research articles. So in 2017, Lanzi and co-authors studied memory communication strategies for adults with dementia. This article specifically looked at external strategies, which rely on the environment to trigger recall. As a result, there is a reduced cognitive demand on memory for the patient. External strategies can be anything from a written note, a planner, or a calendar. The article also noted that the use of external strategies has been found to increase turn-taking and topic maintenance. So an example is a memory book, as I mentioned, and if the patient is using a memory book and communicating with his or her spouse, it is more likely to stay on topic, as there is a visual aid to keep reminding them what the topic is. It is also important to note that the most effective external aids are ones that the patient and family have been a part of choosing and revising if needed. This fits into the ACM in the fact that choosing an external aid considers the wishes of both the patient and the family. This aspect can also tie into the ACM of the psychosocial dimension, such as it's important to know who the patient was before being diagnosed with dementia. This is done by interviewing the family and can help in choosing the most effective external aid and what to include in that external aid. In 2016, Murray looked at a restorative approach known as space retrieval training, or SRT. The findings were developed from a systematic review. So Murray found that the use of SRT was supported across all the studies she looked at for patients with Alzheimer's disease, and the participants in the study they presented with a mild severity of dementia and a few with severe dementia, so it's important to note the range in severity. Although there was variability across the studies of SRT protocol, some participants in each study benefited from SRT, which was shown to improve the ability to recall trained semantic memory targets. As we know, dementia affects cognition. As a result, an SLP will be consulted and play a role in management issues for this disease. So fitting into the ACM, it is important to remember the patient and family is always in the center. The hippocampus is known as our memory center. So damage to this area can result in one of two amnesias. Antegrade amnesia is the inability to form new memories. An example of this would be not being able to remember someone you recently met. And retrograde amnesia is the inability to remember memories that were made before the damage to this area. So an example of this is a patient not being able to remember his or her wedding day. Because the subcortical structures and the motor strip are kept intact, speech production is not affected. So relating dementia to the discipline of speech-language pathology primarily reflects to memory, as I mentioned before, that speech production remains spared. So there are three types of memory: episodic, which relates to personal events the patient has experienced. So an example of episodic memory is the patient's wedding day. Declarative relates to general facts and is also known as factual or semantic memory. An example of declarative memory is knowing that football is a sport. And procedural memory is a learned skill and the ability to learn new skills. So an example of this is getting dressed. The goal of therapy is to maintain and preserve functioning. So we must ask the question, can this patient benefit from therapy? This question ties into the ethics aspect of the ACM. If the patient cannot benefit from therapy because of being in too late of a stage in the progress, it is unethical to treat this patient. So we look at the research saying compensatory strategies are effective and SRT can benefit with Alzheimer's disease with specifically trained semantic recall. But now let's look at how the implement of these approaches into therapy. So compensatory strategies help the patient compensate for memory deficits and maximize independence. This approach is necessary for moderately impaired deficits or if the patient is suspected to experience worsening of the cognitive skill. Examples of compensatory strategies include, but are not limited to, external memory aids, checklists, memory books, etc. And they can be either internal or external. So an internal compensatory strategy is more like a mnemonic, but this also requires memory and attention skills, which can be troublesome for people with dementia. So external compensatory strategies are more the gold standard and are found to be much more effective, and that's where the memory aids and checklists come in. An example of using an external compensatory strategy is using a sticky note above the bathroom sink to remember to brush your teeth. The restorative approach is found to be more effective in the early stages when cognitive skills are still somewhat high and functional, and if memory is not likely to decline rapidly in the near future. So as I mentioned before, SRT is a restorative approach focused on verbally mediated learning. So it is the retrieval of information repeatedly over durations of time, increasing in length. So the time between the presentation of the stimulus and the response and the request from the clinician for a response is gradually increased. So there's intervals starting at 15 seconds and then you double the wait time. So 15 seconds, 30 seconds, a minute, all the way up to 16 minutes. Once the patient gets to 2 minutes, the clinician is supposed to incorporate an activity, which can be targeting another treatment goal before asking the patient the question again. The goal of SRT is for the patient to learn a new behavior. The stimulus can be a name or a face of a family member or even a question. If the patient responds with an incorrect answer, the clinician is supposed to provide the correct answer with a visual cue and then ask the question again. Dementia is a neurodegenerative progressive disorder that has many complex clinical features. The hippocampus is primary area of the brain that is affected. We looked at two research studies that discussed earlier the two intervention approaches, restorative and compensatory strategies. And to tie it all in, compensatory strategies are appropriate for all people with memory deficits, while restorative approach is more effective for patients in the earlier stage of dementia. And then these are the references that I used.